Hello, everyone. My name is Brittany Miller, and I'm a nurse practitioner at the Pinellas Care Center. Today, I'm going to give a presentation on the Villages Health Best Care Promise. Your Villages Health primary care physician will lead a team of medical professionals to ensure you get the right care at the right place at the right time. The Villages Health coordinates your care with specialists when you need them and work tirelessly to keep you out of the hospital and urgent care facilities so you can live out your dreams here in the Villages. The Villages Health provides multiple levels of care to meet your healthcare needs. This is a look at our care continuum. On the next few slides, we're going to talk about each one of these specifically. Up first is our nurse triage program. These are clinical nurses that are available to speak with you on the phone to triage or obtain detailed information about your symptoms. With this information, they can then provide guidance on self-care techniques if you do not need to be seen, or expedite scheduling with a provider if you do need to be seen. These nurses are available from 7 a.m. to 6 p.m. Monday through Friday. We also offer same-day and fast-track visits. The Villages Health can see you for same-day appointments. Providers have same-day appointment blocks on their schedule each day. Fast-track appointments are also available, and these most often happen during our busy season. These are expedited 20-minute appointments for things like urinary tract infections and upper respiratory infections, just to name a couple. We also have the Saturday Clinic. This is held at the Villages Health Creekside Care Center near Lake Sumter. It is staffed by a Villages Health physician with scheduled appointments from 9 a.m. to 2 p.m. These appointments are typically made by an on-call provider that you've called because of concerns about a health condition. We also have our after-hours on-call provider, which is staffed by a provider from your home care center. You would simply call the office line, listen for the prompts, which would ring you through to the on-call provider, who answers the phone on the weekends and from 5:30 p.m. to 7 a.m. on the weekdays. These providers will have full access to your chart and will provide your provider with an update about your call. Hospitalists. If you are admitted to the UF Health, the Villages Hospital, a Villages Health hospitalist will manage your care while you're there. A Villages Health nurse navigator will also help coordinate your care both during your stay and after your discharge, specifically getting you set up for a hospital follow-up with a provider in your office. Our hospitalists are in regular contact with your primary care provider and specialists. Care management. The Villages Health Care Management Team provide additional support for patients with complex medical conditions and those that have recently been hospitalized. Our care management team will help coordinate appointments and resources, check in on how you're feeling, and provide regular updates to your healthcare providers. Working with your healthcare provider. How to pre-plan for care needs. Those patients with chronic conditions should work with their healthcare provider to develop a plan for what to do if an urgent matter arises. You should come up with a plan and decide what is considered normal for your conditions, when should you contact your healthcare provider, and when should you call 911 or seek emergency care. We can also provide care away from home. The Villages Health cares for you whether you're here in the Villages or elsewhere. Your healthcare team can provide guidance and care via phone, portal, or a telehealth visit. Need care? Call the Villages first.